Hi, this is Palaniammal, nurse educator at Dr. Mehta's. In this video, we are going to learn about the breastfeeding hold. As we all know that breast milk is the ideal food for the newborn. It is the safe, clean and contains more antibodies which helps to prevent or protect against many common childhood illnesses. And breast milk provides all the energy and nutrients that the newborn needs for their growth and development. Let us see the benefits of breastfeeding for the newborn as well as for the mother. What are the benefits of breastfeeding for the newborn? Breast milk has perfect mixture of vitamins, protein and fat, everything baby needs to grow. So it provided in the form so it's more easily digested than infant formula. Breast milk contains more antibodies that helps the baby to fight against many viruses and bacteria. And also breastfeeding lowers the risk of having asthma or allergies. And babies who are breastfed exclusively for the first 6 months without any formula have fewer risk of ear infections, respiratory illnesses and diarrhea. Also, the breastfeeding babies have the higher IQ scores in later childhood, and physical closeness of the mother and skin to skin touching, eye contact helps the baby mother bonding and also feel secure. The breastfeed infants are more likely to gain and the right amount of weight as they grow rather than become overweight children. Breastfeeding benefits for the mother. Breastfeeding burns extra calories, so it can help the mother to lose pregnancy weight faster. It releases the hormone oxytocin, which helps the uterus to return it to its pre-pregnancy size and may reduce uterine bleeding after birth. Breastfeeding also lowers the risk of osteoporosis, breast and ovarian cancer. Since the mother don't have to buy and measure formula, sterilize nipples or warm bottles, it saves the mother's time and money. Also gives the regular time to relax quietly with the newborn as the mother bond. Good feeding technique is very much essential during breastfeeding. And look at these pictures, good attachment and the poor attachment. So what are the signs of good attachment? There are 4 signs. The first one is the baby's mouth should be wide open and majority of the areola should be inside the baby's mouth, and the lower lip should be turned outside. Baby's chin must be touched with the mother's breast. These are the 4 signs of good attachment. If the attachment is not well, it's poorly attached, it will end up with some kind of breast issues like sore nipple, breast engagement, breast mastitis, etc. Next, we'll move on to breastfeeding hold. So, breastfeeding position is very important for the good attachment. So, we'll see one by one. The first hold is cradle hold. It involves the mother has to sit upright with a baby position on his side. The baby's head and neck are lying along the mother's forearm and the baby's body against the mother's stomach like a tummy to mummy position. This is called cradle hold. The next hold is cross cradle hold. It is similar to the cradle hold, but arms which rolls the baby's body lies along the mother's opposite forearm. The aim is to support the baby around his neck and shoulders to allow him to tilt his head prior to latch. This is good for small babies and those with latching difficulties. Third one is ruggy ball hold, otherwise called underarm or clutch. In this hold, mother sit with baby resting along forearm and body tucks alongside with baby's feet toward the back of the chair. It supports the baby well and gives plenty of control. Also gives good view of baby's face and feels safe too. Mothers who have had C-section or twins or a premature baby along with those who have larger breasts will be benefited with this hold. Fourth one is double clutch or double ruggy ball hold. It is a great breastfeeding position for twins. We need to use a specially designed twin breastfeeding pillow while feeding like this, especially in the early days. This gives extra support to get both babies into position and also minimizes pressure on mother's belly if mother had a C-section. Fifth hold is side lying. Ideal for relaxed night feeds and breastfeeding in bed or on the sofa. Side lying can also be more comfortable than sitting if mother had a cesarean or stitches. Mother and baby need to lie on sides next to one another or belly to belly. The last one is laid back hold. Laid back breastfeeding is not just for newborns, it can work well with babies of any age. Points to remember for successful breastfeeding. Don't discard colostrum. Breastfeed exclusively for 6 months. Feed the baby at least 8 to 12 times per day. Feed the baby on demand. Nurse until the baby is satisfied. Burp the baby during and after each feeding in order to prevent aspiration. Don't skip feeds, especially during night. Don't give honey, water, and gutty water to the baby and avoid using pacifiers. Thank you for watching this video.